Hi, welcome to Facts Know How. In today's video we're going to learn some very important information and facts about monkeypox virus, which is spreading around the world day by day. Let's get started. What is monkeypox? Monkeypox is a rare viral disease that is similar to smallpox, but less severe. It is caused by the monkeypox virus, which is transmitted to humans through contact with infected animals or humans. The disease was first identified in monkeys in 1958, but it was not until 1970 that the first human case was reported. Since then, cases have been reported primarily in Central and West African countries, but sporadic outbreaks have also occurred in other parts of the world. The symptoms of monkeypox are similar to those of smallpox, but they are usually milder. The disease typically begins with flu-like symptoms such as fever, headache, muscle aches, and fatigue. A rash then develops, which typically starts on the face and then spreads to other parts of the body. The rash progresses to form fluid-filled blisters, which eventually scab over and fall off. Monkeypox is a self-limiting disease, meaning that it usually goes away on its own without treatment. However, antiviral medications may be used to help reduce the severity of the symptoms. Vaccines are also available for people who are at high risk of infection, such as healthcare workers and laboratory personnel who work with the virus. What are the symptoms of monkeypox in humans? The symptoms of monkeypox in humans can vary from mild to severe and typically appear within 5 to 21 days after exposure to the virus. The symptoms usually begin with flu-like symptoms such as fever, headache, muscle aches, and fatigue. These symptoms are followed by the development of a rash, which typically starts on the face and then spreads to other parts of the body. The rash progresses to form fluid-filled blisters, which eventually scab over and fall off. The rash may be accompanied by other symptoms such as chills, sweats, lymph node enlargement, and back pain. In severe cases, the disease can cause pneumonia, sepsis, and even death, particularly in people with weakened immune systems. The symptoms of monkeypox can be similar to those of other viral diseases, such as chickenpox and smallpox, so a laboratory test is needed to confirm the diagnosis. If you have been in contact with someone who has monkeypox or have recently traveled to an area where monkeypox is present, and you are experiencing symptoms, it is important to seek medical attention as soon as possible. How can I prevent getting infected with monkeypox? There are several ways to reduce your risk of getting infected with monkeypox. 1. Avoid contact with wild animals that may carry the virus, such as rodents and primates. 2. Wash your hands frequently with soap and water, especially after touching animals or animal products. 3. Cover any cuts or scratches on your skin with a bandage or dressing. 4. Avoid close contact with people who have monkeypox or who have been in contact with infected animals. 5. If you work with animals or in a laboratory that handles monkeypox virus, take appropriate precautions such as wearing gloves, masks, and protective clothing. 6. Consider getting vaccinated if you are at high risk of infection, such as healthcare workers and laboratory personnel who work with the virus. 7. If you are traveling to an area where monkeypox is present, avoid contact with animals and be sure to follow all recommended precautions. If you have been exposed to someone with monkeypox or are experiencing symptoms, seek medical attention immediately. Early treatment can help reduce the severity of the disease and prevent complications. What is the common treatment for monkeypox? There is no specific treatment for monkeypox, but there are several measures that can be taken to help manage the symptoms and support the patient's recovery. Treatment typically involves supportive care, such as 1. Resting and drinking plenty of fluids to prevent dehydration. 2. Taking over-the-counter pain relievers such as acetaminophen or ibuprofen to reduce fever and relieve pain. 3. Treating secondary bacterial infections with antibiotics, if necessary. 4. Taking antiviral medications such as cidofovir or brincidofovir to reduce the severity of symptoms, although these medications are not always effective. 5. Isolating the patient to prevent the spread of the disease to others. 6. Monitoring the patient's condition closely and providing additional medical care as needed. It is important to note that most people with monkeypox recover without complications within a few weeks, and the disease is usually self-limiting. However, some people may develop more severe symptoms or complications, particularly those with weakened immune systems, and may require hospitalization. If you have been in contact with someone with monkeypox or are experiencing symptoms, seek medical attention as soon as possible. What is the mortality rate of monkeypox? The mortality rate of monkeypox varies depending on the outbreak and the population affected. In general, monkeypox is a less severe disease than smallpox, and the mortality rate is lower. The overall mortality rate for monkeypox is estimated to be between 1% and 10%, with the highest rates occurring in Africa among people with weakened immune systems. However, the mortality rate can be higher in certain populations, such as young children and people with weakened immune systems. In addition, the severity of the disease can vary depending on the strain of the virus involved. It is important to note that most people with monkeypox recover without complications within a few weeks, and the disease is usually self-limiting. However, some people may develop more severe symptoms or complications, and may require hospitalization. If you have been in contact with someone with monkeypox or are experiencing symptoms, seek medical attention as soon as possible. Thank you for watching this video. Please subscribe and like for informative videos. We truly value your time.